OBGYN 15 years ago, I was like that doctor that Kim mentioned. I routinely encouraged and provided artificial contraception to my patients. Like the American College of OBGYN states, I believed that artificial contraception was basic, preventable health care that should be accessible and provided to all patients. Now, I've been Catholic my whole life, and very Catholic. I'm the youngest of 8 kids, and my mom, who's sitting over there, she used to have us say the rosary every night together. And when I was really small, my aunt used to take me to daily mass, and when I went to college and medical school and even got out and was working, daily mass was a pretty regular part of my life. And so I grew up loving the church and knowing that God was the glue that kept my family together and was the center of my life. And so as a practicing Catholic, I also knew the teachings of the Catholic Church. I knew that the church taught that contraception was harmful and dangerous. I had read that there had been a papal commission in the 1960s examining the morality of artificial contraception. It started with Pope John the 23rd and continued to Pope Paul VI. And I knew at the end of that commission, Pope Paul VI held up the teachings of the Catholic Church that had been in place since the beginning of the church. But I also knew that some of the theologians that had been on that panel had dissented. And some of these theologians were really smart, and they were religious, and some of them were priests, and they dissented publicly and vociferously. And as an OBGYN, I saw people getting pregnant who shouldn't get pregnant. 15-year-olds getting pregnant, women addicted to cocaine and heroin getting pregnant. And so I thought, shouldn't these people have birth control? And so if these people who are religious and smart and theologians can dissent, then I can dissent too. And what I never could really reconcile was, why did the church teach that NFP was okay, but artificial contraception not? What was the difference? And then about 3.5 years ago, somewhat unexpectedly, a series of events occurred, and it became very, very clear to me that God was telling me that He wanted me to stop. And frankly, it was a very painful conversion. I remember being in Emmitsburg, just praying and really upset and praying, God, please, 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 don't let this be what you want for me. If you want this for me, I will do it, and I know that you will give me the strength to do it, but please don't let this be what you want for me. The persecution and mockery I knew I would face terrified me. And today is the Feast of Our Lady of Sorrows, and Father Papiano gave a homily today. And he was talking about, the Virgin Mary at the foot of the cross, how her suffering is united to his. And when you read the lives of the saints, I had at the time been reading St. Therese of Lisieux, and she talks about, how I love suffering for Jesus. And I remember thinking, well, I love you, Jesus, but I don't want to suffer for you. I dread suffering. But nonetheless, it was very clear that I was being called to this. And I didn't feel like I had a choice in some way. I knew that there is no happiness outside of what God's will is for you. Even if you try really, really hard, it just doesn't really work out. So I stopped giving birth control. And slowly, I began to finally see and understand why the church was right. The contraception was harmful to people, and it didn't do the things I thought it would. And it certainly, unexpectedly, helped me to become a better doctor. Often as physicians, we treat our patients just as physical bodies. But of course, we are not. We are body and soul made in the likeness and image of God. So, for example, I had a 14-year-old who came into my office with her mom. And they sat down and her mother said, we're here to start her on birth control. I don't know what's going on. She started 9th grade, and she's gone boy crazy, and we need to protect her. And And so I asked the mom to step out, and I talked with the girl, and she told me she was in 9th grade, and she had a boyfriend. They hadn't yet had sex, but she wanted to be on birth control just in case it happened by accident. So wait a minute. When you are having sex with somebody, you are giving your whole self to that person. There is nothing more that you can give. And so that should never be something that happens by accident. Sex is something that should make you feel special and holy and loved and cherished. And every day I see women coming in here suffering because they've had sex under the wrong circumstances. And I don't want that for you. As a physician, I think it would be harmful for you to start having sex right now. I think that this is the wrong decision, so I am not going to give you birth control. So let's bring your mom in. So her mom comes in, and I brace myself for her reaction. If it had been me 6 months ago, I would have given her a shot of depo and sent her out of her way, sent her on her way. And her mother, so I give her my spiel, and her mother almost starts crying. And she says, thank you so much. I don't want my daughter to start having sex right now. If I could have made decisions differently for myself, I would have. But I don't want my daughter to start having sex right now, but I didn't know what else to do. And I said, well, if you didn't want your daughter to drink and drive, you wouldn't say don't drink and drive, but if you do drink and drive a really big SUV, so that if you smash into someone, you'll decrease your chances of getting hurt. It just makes no sense. And so she hugged me, and they left the office really light on their feet. And all I had done was reaffirm what she as a mother already knew to be true. She already knew what was good for her daughter. But we get so many mixed messages. And I had thought that artificial contraception would give women freedom, right? It would liberate us. It would give us more options. And as I began to practice, I began to see that artificial contraception just enslaved us in a different way. So this is a really compelling article. This is the Atlantic magazine. We get it at our house. This is the November 2011 issue. And the cover says, what, me, Mary? And it's written by this author, Kate Bolick. It's not really a pro-life article. In many ways, it's an anti-pro-life article. But regardless, she goes into sex, dating, and marriage now, in the modern age. And she talks about how the 1990s witnessed the dawn of the hookup culture at universities, where it was very common and became the norm for lots of people to have lots of casual sex and one-night stands. And she interviews these women, and she states from her article, quote, most of them said that though they had a lot of sex, none of it was particularly sensual or exciting. Men and women come together in drunken couplings, fueled less by lust than by a vague sense of social conformity. So men and women come together by a vague sense of social conformity. She goes on to say, quote, most striking to me was the innocence of these young women. Only two had ever had a mutually exclusive and satisfying relationship rather than a series of hookups. And one woman whispered to me in undisguised alarm, speaking about having lots of partners and having to do all of these hookups, I don't think I can bear this. I don't think I can bear doing this for that long. And this article resonated with me because it's what I see every day as an OBGYN. My patients come to me routinely for STD screening, for screening for sexually transmitted diseases, because they are unsure about their partners. And I always ask them, why are you having sex with somebody that you don't trust? And pretty much, almost always, the answer is, I want him to like me. If I don't have sex with him, he's going to have sex with somebody else. I have no reason to say no. It's what he expects from me. This is not women liberated. We are only doing something, again, that's not in our best interest, that is harmful to us, because it's some man's or society's expectation. And I see this all the time. So, for the 15 years that I did tubal ligations and fit diaphragms and performed and prescribed the pill and put in IUDs, I did it because I thought it would prevent abortions. Right? If you don't get pregnant, if you avoid an unwanted pregnancy, you won't have an abortion. But paradoxically, the incidence of abortions has only gone up in the United States, along with contraception. So right now, we do about 1.5 million abortions a year. 50% of the women who present to an abortion clinic are on contraception. Of the other 50% that present to abortion clinics, the majority of them had been on some contraception. So at least 80% of people getting abortions have been or are using contraceptive. And so it has not stopped them in any way from getting their abortion. And I see patients use their contraceptive as a way to legitimize their abortion. You know, I had a 19-year-old who was on the Depo-Provera shot, and she got pregnant. And she had an abortion with seemingly no remorse. She said, Dr. Sorra, I did everything right. I was responsible, I was on a reliable contraceptive, I got pregnant, and this is not my fault. And in all of her rationalization, she never thought, I am using this Depo-Provera shot so that I can have casual extramarital sex. And it is this casual extramarital sex that caused the unwanted pregnancy, that caused me to get the abortion in the first place. So the abortion wasn't preventing her, the contraceptive wasn't preventing her abortion. So I also believed that birth control would help decrease unwanted pregnancies. So this is last month's OBG Management magazine. Pretty much all board-certified OBGYNs get this magazine. And the focus on contraception is the topic. So it states in the article, in many of the articles actually, quote, it states, the past 20 years have seen an explosion of new contraceptive technologies. Women benefit now from a range of effective methods that can satisfy their preferences. Now that many of these newer products have been available for a decade or longer, this should have meant a better success in preventing undesired pregnancies. Regrettably, we're moving in the wrong direction. The rate of unintended pregnancy in the United States has increased. The fact that this rate has not improved in nearly 20 years is worrisome. Despite a proliferation of methods of contraception, an overall benefit has not been realized. Right? The fact that this rate has not improved in nearly 20 years is worrisome. Despite a proliferation of methods of contraception. What a paradox. So the editor-in-chief, his solution to this paradox of increasing unwanted pregnancies despite more and more contraception is, let's increase our use of IUDs and improve contraceptive effectiveness in this country. The unintended pregnancy rate is too high in the United States. And so happily for him, the FDA recently approved the IUD for girls as young as 16 years old. You used to have to be married and used to have had a child and had a lot more requirements before you could put an IUD. But now you can put an IUD in somebody as young as 16 years old. And so recently, on labor and delivery, a 16-year-old came in and she was having her second baby. And the resident said to me, we need to put an IUD in that girl as soon as the placenta comes out. Now, this girl had been on labor and delivery 2 years ago in the same situation, and here she is again. And our best solution for her, or our best understanding of her problem, is that she received poor contraceptive counseling a year and a half ago. Was that her underlying problem? Of course not. This girl needed parents who were loving and guiding her. She needed to realize the dignity of her self-worth, the dignity of herself as a human person. She needed to stop looking for love in all the wrong places. She needed to know that there was a God that loved her so much that he opened his arms and died on the cross for her. The last thing she needed was an IUD. So this is a radical departure of our society today. We thought that artificial contraception would help us with our options, free us up, decrease unwanted pregnancies, and decrease abortion, but in fact it has done the opposite of those things. So what about for couples who are happily married? What's the difference if a couple uses a pill or does NFP? So is the efficacy different? Well, actually no. When couples use a modern, reliable form of NFP that does not include the rhythm method, it is as effective as the pill and actually more effective than condoms and diaphragms at preventing unintended pregnancy. So there was a study in the British Medical Journal in the late 1990s, 1996, that took 17,000 women in India and taught them the Billings ovulation method of NFP. And the unintended pregnancy rate, I think it was over 7 years, was 0.2%. So it is amazing that God made us so perfectly that if we are able to understand our bodies and understand how they work, we can take control of our fertility. And modern NFP does work in people who have irregular cycles, who are perimenopausal, who are breastfeeding, have PCOS. It's more difficult and you might need to find a doctor who's able to help you out, but it is absolutely doable. What about the philosophy of NFP? So, Pope John Paul II talks about when a husband and wife are together, their love is a way of experiencing God. When a husband and wife love each other, they promise to love each other freely. Do you come of your own free will? They promise to love each other faithfully. Do you promise to be faithful to each other? They promise to love each other fruitfully. Will you lovingly accept children from God? And they promise to love each other completely. Do you give your whole selves to each other? And so this love that is free, faithful, fruitful, and complete is the way that God loves us. He loves us freely. There is nothing you could ever do to earn his love. He loves us faithfully. Despite our sinfulness, he never abandons us. He loves us fruitfully, giving us everlasting life. And he loves us completely to the point of giving up his son to die on the cross for us. Now, when a married couple has conjugal relations, that too is supposed to be an experience of God. It's supposed to be a reaffirmation of their marriage vows. It's that special. So when a couple comes together and has intercourse, it is supposed to be free. They come willingly. They're supposed to be faithful. They're not having other sexual partners outside of their marriage. It comes fruitfully, meaning out of that union, a whole life can be created. Right? A sperm is just a sperm and an egg is just an egg, but when the two unite, it is God who infuses that conception with a soul. And they give themselves completely. And so God made sex to be something beautiful and holy. He made sex for bonding and babies, as Janet Smith says, or life and love. And so when a couple uses NFP, always at the heart of it, they realize that God is the center of their relationship and the center of their lives. And so even if they're using it to avoid pregnancy, they are still embracing the gift of their fertility and recognizing that this is a good and holy thing. Now, when a couple contracepts, it might not be conscious, but they're not giving of themselves really faithfully, fruitfully, or completely. When a husband puts on a condom, he's not giving of himself completely. When a woman takes a pill, she's treating her fertility as a disease, something to be stamped out. Is there anything free or faithful or fruitful about cutting into a man's scrotum and severing his vas deferens? Is there anything free or faithful, I can't believe it, that I used to do it, of cutting into a woman and mutilating her fallopian tubes so that they don't function? Is there anything free or faithful or fruitful about that? What about the side effects of natural family planning? There are none. It's organic and green. Some people do worry about or are concerned about the abstinence that is required in NFP. But they shouldn't, because when a couple has sexual relations, it's an act of love. And when they abstain, that too becomes an act of love. They say, I love you so much that I'm going to put my desire away to do what's best for us as a couple. And we know there is no love without sacrifice. The greatest example of love is that of Christ crucified. And so while abstinence can be difficult, God gives us his own example to show how that abstinence and that suffering can be transformed into an act of love. It's very beautiful. What about the side effects of contraception? Well, you can watch the TV commercials, and at the end it lists, you might have nausea, vomiting, heart attack, stroke, or blood clot. And my husband and I were watching TV, and there was a commercial for season 8. It's a birth control, and they did say that you can have this, that, and at the end, and a heart attack, stroke, or blood clot. And my husband looked at me and said, I don't ever want you to be on that. And I would assert that a man that loves his wife would feel that way. And there was a 21-year-old girl who came to the emergency room who needed surgery that night, and I was on call, and she needed surgery because the IUD had perforated her uterus. And I just remember thinking, I am so glad I'm not responsible for this. So I think, though, the most sinister side effect of birth control is that of an abortifacient. So IUDs and hormonal birth controls, well, the pill is supposed to keep you from ovulating, and usually it does, I think, although the lower dose pills not so much. But regardless, the pill and IUDs change the lining of the uterus so that if a person conceives, that pregnancy cannot implant into the lining of the uterus. And so it acts as an abortifacient post-conception. So in the United States, before the advent of the IUDs, it was widely accepted and recognized that life began at conception. There was nothing else really made sense. But once the post-implantation effects of the IUD became known, science didn't want to stand in the way of progress, so we decided to change the definition of when life began. We actually changed the definition of when life began so that we could suit the IUD contraceptive. And so now there's only a minority of people that recognize that life begins at conception. And so this has paved the road for more blatant abortifacients, like the morning after pill or emergency contraception. And when we changed the definition of when life began, it also allowed us to start creating embryos so that we could do pre-implantation genetics and decide who lives and dies based on their sex and their genetic makeup, and to pursue many other morally bankrupt endeavors, all for the sake of furthering science and achieving some misguided idea of happiness. And this never would have been possible if contraception had not paved the way first. So 2 different women that I know who are here came up to me and said, so you're going to talk about NFP, are you going to talk about the bad part about NFP? I was like, well, no, this is a pro-NFP talk. But I realized it wouldn't really be forthcoming to not talk about the struggle of NFP for some people. Because not all couples think that NFP is awesome. Some women find NFP annoying, yucky, confusing, and arduous, and some men are not on board. They're not supportive or cooperative. And so while NFP is supposed to bring families together, sometimes NFP can actually put a strain on a couple. And sometimes people get pregnant on NFP, or they have a pregnancy that wasn't intentional. And so these are real issues, and to that, I can just say pray and ask for God's grace. You know, sometimes being a Catholic Christian is hard, and sometimes it's a struggle. And it's a cross, and yet we are called to take up that cross and be faithful. So St. Paul writes to the Hebrews, at the time, all discipline seems a cause for joy. At the time, all discipline seems a cause not for joy, but for pain, yet later brings the peaceful fruit of righteousness. So a Dominican sister who was a doctor was here in Baltimore last week, and I was talking to her, and she was comparing being a Catholic Christian today like being in the resistance movement. You know, when she was talking about how living a life rooted in Christ can be so countercultural and can be so lonely. And one of the most powerful passages in the Bible for me is it was read over the summer, but the Bread of Life discourse, John chapter 6. And it's starting with verse 60, it says, then many of his disciples who were listening said, this saying is hard. Who can accept it? As a result of this, many of his disciples returned to their former way of life and no longer accompanied him. Jesus then said to the 12, do you also want to leave? Simon Peter answered him, Master, to whom shall we go? You have the words of everlasting life. So you may find the teachings of the church on artificial contraception difficult, and you may not agree with them. And that's okay. You should use that doubt to learn more and seek the truth with a sincere heart. If you have never heard Janet Smith's Contraception, Why Not?, I would encourage you to purchase it. It's in the back. It was instrumental in my conversion. And also as a doctor, it's really been amazing to help people by using NFP. You know, I've helped a lot of people get pregnant, or God has helped me help them get pregnant. There was one woman who was turned away by the IVF clinic. They're like, we cannot get you pregnant. You can only get pregnant by using donor eggs. But by using NAPRO and hormonal studies and all of that, she delivered her baby this year. So it's been tremendous. So God is good. You know, so God is good. So though it is at times lonely and difficult being the only OBGYN in Baltimore who doesn't prescribe birth control, and though it can be lonely and difficult being the only couple you know that only does NFP, there is nothing like the freedom of being on the right road. That's real freedom, the ability to be who God is calling you to be. And that's what we are all called to. Thank you.